So hi everybody, welcome to this webinar on chronic fatigue syndrome. Hopefully it should all be up and recording. I don't know why there's lines on that slide, but anyway, so welcome. So webinars, why am I doing these webinars? Really to do the webinars was to reach a larger audience and touch more people's lives. I was teaching for quite a while and yeah, just really wanting to get to larger audiences, wanted to talk to people and connect with people. Part of my whole purpose is really about, strengthening the connection with people and people to connect deeper with themselves. And part of these webinars is actually to educate people so that they can learn things to deepen the connection with themselves. And today we're talking about chronic fatigue, and what's actually happening in your body that can be creating this chronic fatigue in your system. Today as well, I also do life transformational seminars called Vita More seminars, where people come in for about 3 days in-house and we work through whatever issues they have and help to transform them. Plus, I've got a 6-7 week lift-off program, which I will talk to you about at the end. So here's just a testimonial from someone from the seminars. I feel more confident in myself. I have greater understanding of where my suppression has come from. I don't know why that's clicking forward. Yeah, so it's rolling forward. So chronic fatigue, basically what is it? It's an unexplained fatigue that lasts for at least 6 months. When we rest, it doesn't basically get better. It interferes with our lives. So I always use the analogy that it's like driving with your foot full on the accelerator, but your foot also on the brake. So there's been studies in the US and the UK and in Japan giving some information which is shown here. It can affect between 400,000 and 900,000 American adults. So it's pretty prevalent and it's very much around. It's become its own sort of disease from 1988 called chronic fatigue and immune dysfunction syndrome. And the things that highlight it and make it become chronic fatigue really is the extreme fatigue, muscle and joint aches, muscle weakness, chronic headaches, swollen glands, periodic fevers and chills, having a sore throat, numbness and tingling of the extremities, an inability to cope with any stress, cognitive dysfunction, and also insomnia. So these are signs that are commonplace. Some will be more prevalent than others. So it's quite closely linked to fibromyalgia as it shares a lot of the same symptoms. And in 1990, the American College of Rheumatology established a diagnostic criteria for fibromyalgia that included incapacitating fatigue, muscle joint pain, neuralgia, sleep disorders, anxiety, depression, cognitive diffusion and digestive problems, so very closely linked together. So here we've got just a little diagram showing prolonged states of fatigue and the connection there with things like depression, anxiety, irritable bowel, chronic fatigue and fibromyalgia. And of course the severity and the intensity can really change according to the individual. So what things can contribute to this? So to me, treating this with people, which I've treated many people over the last 20, 30 years, you've got to look at what's the underlying issue, and viral load is usually a big one. Stress is a big factor that affects it. Chemical toxicity is another one as well, whether it's heavy metal toxicity or multiple chemical sensitivities. And that would be a focus as well. So in doing that, you need to do a detoxification, like liver detox. There's also gut dysbiosis, which basically is issues with leaky gut. There's a down-regulation of mitochondrial energy. So mitochondria is the powerhouse of the cell, so that can be an issue too. There can be food allergies and things like hyperglycemia. Hypothyroidism can be an issue. So there's a glandular component. Poor adrenal function, taking medication depression, sleep disorders, mycoplasma infections, and staph infection in the nose, gut, and urine. So these are all things that contribute. So often it can be a compilation of these. It's not just one thing. You know, there could be food allergies, there could be some gut disorders, there could be some chemical overload, there could be a viral infection. So, you know, these 3 or 4 things get together. So, you know, PCBs, insecticides, DDT, dieldrin, these are basically are chemicals that they can be mobilized from adipose tissue during viral infection. So, you know, we have exposure to these chemicals. They can just sit there in our system, and then once we get a virus, then they can actually become activated. So headaches, muscle weakness, aching joints, memory loss, irritability, impaired balance, and insomnia. So they also can be things of like excessive production of nitric oxide during the inflammation infection. This again causes uncoupling of oxidative phosphorylation. So basically poor energy formation, poor energy, The body, the mitochondria, which is the energy power centers of the cells, aren't able to produce energy. So with this comes sleep disturbances. There can be, you know, disturbance in cognitive function as well. So our mood and our energy is very affected. So most healing, repair, immune activity and restoring of hormones and neurotransmitters occurs during sleep. So there's another slideshow here on my channel that you can have a look at, sleep, and, you know, it talks about how immune function, hormones and neurotransmitters are very closely related to that. So stress will also increase prolactin, it reduces dopamine, and we need that to feel and help feel better. Stress will also block insulin receptors, so we need to increase insulin to get glucose into the cells, and increased insulin will block fat burning. So the strong stress hormone component that would want to be addressed. So there's also the body-mind component where the body, you know, to me, chronic fatigue is often something like just in overwhelm, overload, too much going on, can't cope, can't manage things anymore, so it's just all too hard. So we know that our consciousness creates our reality, our mind becomes matter, and through our thoughts, then this matter becomes basically our physical reality. So what happens in our minds at the level of our perception, so how we're perceiving we are, how we're feeling, what we want, what our needs are, how happy we are, this is all our own perception. And our emotional reaction to that perception can have an effect on our physiology and on our immune system. So really, to put that in simple English, like how we perceive ourselves will have effect on our physical body and our health and our well-being. So the brain is not only communicating with the body via the nerves and the hormones, but also through other chemicals as well, connected to the nervous system. We've also got neuropeptides and their receptors joining the brain, the glands, and the immune system, a network of communication. So there's a big communication system again between the brain and the heart and the gut. So these are very much all connected and are very important. So other things that have come up, they've shown that emotional suppression will equal stress, depression, and poor immune suppression. So if you've got those, you know, if there's depression, stress, and poor immune function, then basically you are leaving yourself predisposed to allow something like chronic fatigue to flare up. So our emotional expression is linked to the flow of peptides in the body, which is the protein component. Chronic suppression of our emotions will give us a massive disturbance in our psychosomatic network. So in the communication pathways in the body, if there is chronic suppression of emotions, then things start not flowing very well. So all our emotions are healthy. It doesn't matter what they are, because emotions unite our body and our mind. And even, you know, so-called negative emotions, anger, fear, sadness, are just as healthy as peace, courage, and joy. The question is what we do about them. So there will be a slide show coming up about emotions at some stage. So if we repress how we're feeling and don't let it out, basically it causes a dysregulation or a disintegrity causing it to act at cross purposes rather than a unified whole. When stress prevents molecules of emotions from flowing freely where it's needed, a lot of the autonomic, which is the automated processes in the body, so breathing, blood flow, immunity, digestion and elimination, and basically collapse and stop functioning so effectively and upset the healing responses. So what is it of importance? Basically, whether we have positive or negative emotions, is that we learn to resolve these, and this will help reduce our stress, and then in turn will help our immune system to function easily. So there's many ways of doing that, which we won't be covering all of them here. So there is a link between early childhood trauma and chronic fatigue, related to the hypothalamic pituitary adrenal axis, which is part of our emotional brain and our limbic system. So these secrete neuropeptides, which is cortical releasing factor. This controls the release of other informational substances. So when the CRF hits the pituitary gland, it stimulates the ATCH, which basically then travels through the blood to the adrenal glands, which then, you know, goes on to cause them to make steroids, corticosterones, which is basically for damage control when injury has occurred. So, you know, when there is, put that quite simply, you know, when we've got trauma, we've got, you know, excessive amount of stress happening in the body then goes into a bit of an immune stress response. And the body starts really producing stress hormones, but also produces corticosteroids because it's corticosterone, because it's actually trying to heal and repair a damage. So quite simply, the body's sort of into alert healing mode, armies ready for defense and attack and healing. And of course, that can then be switched on. So it's almost like you're switched on, stimulated. As I said, you got the foot on the accelerator, go, 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 go. Yeah, and it happens from an early age and keeps going. So it's the long-term stress that basically it reduces the receptors. So, you know, if you keep your foot on that accelerator and you keep going forward, then your receptors just become immune to it as such. You know, the receptors will desensitize, they will shrink in size, and they will decrease in numbers. So when that happens, the receptors become flooded with a drug, whether it's one your body's taking or a pharmaceutical one that you're doing. The memory of the trauma is stored by these and other changes at the level of the neuropeptide receptors, sometimes occurring in the interior of the cell at the very roots of the receptor. So really long-term stress isn't good. So there are studies suggesting that traumatic events, as well as prolonged stress, is linked and associated with the development of chronic fatigue. One study compared 43 chronic fatigue patients with 60 healthy. Both groups were questioned about the kinds of trauma that they had had. The chronic fatigue patients had highest trauma scores than those not in there. They were also more likely to have psychiatric disorders, so more likely to have depression, anxiety, post-traumatic stress disorder as well. A second study was carried out in Sweden with 19,000 twins. That's a lot of twins. And of those, 1,600 patients suffered from chronic fatigue. They looked at, they were analysing the emotional instability and stress, compared a chronic fatigue patient to his or twin without it. Yeah. So other things that have been linked and connected to chronic fatigue is also fungal infections and candidiasis. So actually having overgrowth of Candida albicans in the system, yeast overgrowth. So, you know, taking prescription antibiotics, antifungals as well, that's going to wipe out your natural line of defence. Candida is meant to be in our gut, it's there, but what happens is it ends up overgrowing and taking over. And of course, once we've got an overgrowth of candida, then our body just craves food to keep feeding that, and the food that we often eat then starts to lower our immune system even more, and then the cycle just starts to go on and on. So yes, having a defungal, having a candida cleanse is something that's considered as well. So the other thing is basically the viral infection. So we have a virus, and sometimes it's a correlation of viruses. So you can end up with, glandular fever. I had treated a client this week, same thing, glandular fever when she was younger. Then she's had another virus, and now it's heading up this page, up the street to chronic fatigue. So there, you've got these layers of infections that have never basically been resolved. So convalescence is essential. On a more energetic level, there's solar plexus issues there. So the energetics for glandular fever is not accepting yourself and not wanting to be told. Also living in the past and not allowing the pineal gland to open to new things and the present. So other things that I see time and time again is heavy metal toxicity. So basically heavy metals coming in, copper, lead, aluminium, cadmium, sulfur, nickel, mercury, antimony, arsenic. We can be getting that from, kebab sticks, from fish. We can get it from water, cooking in aluminium pots, water pipes, cigarette smoking, additives in food. Like there's jewelry. There's just lots of ways we can actually get exposed to metals. And the other thing is that we can carry that through our family. So I don't know if your father was a ship painter or something, there can be a biogenology link connecting, the issues with the metals in your parents' father's blood with yours. So signs of mercury toxicity here is weakness of the hands, band-type headaches, irritability, loss of nerve sensation, mental retardation, rashes, speech difficulties, joint pain, excessive salivation, and cataracts. Mercury can also be fillings. So some of these symptoms are also similar to some of the chronic fatigue symptoms. So where do we find mercury? Teeth fillings, skin lightening creams, contaminated fish, fungicides, algicides, insecticides, so every chemical they spray on food, paper products, newspapers and building materials. Another thing that we can look up is parasites, so the issue of basically a underlying parasitic infection. So this can be a primary lesion. So a primary lesion is basically an infestation or a disease or something that's happened early on, and then other things have happened from that. So, you end up getting a parasite infestation, nothing happens about it, your immune system becomes weakened, the digestive system becomes impaired. The parasites keep basically growing and sucking our life force I've got there. So purging and cleansing is very beneficial, and you'll usually find when you do a physical cleanse, there's an emotional cleanse as well. And energetically, it's about giving power to other people. So from a spiritual perspective, you're looking at the solar plexus, which is the third chakra up, which is below the sternum. Your solar plexus is very much about your reservoir of power. So it's all about, are you moving towards your chosen goals? It's like leaving the womb of childhood. So, like learning to ride a bike, confronting with life directly, overcoming fears, failure, rejection, hopelessness, inadequacy, and despair. So a Louise Hay affirmation would be, I have the power, I am okay as I am, I honour myself, and I am free. Would be good. So why is there tiredness? Basically because there can be poor time management, being a perfectionist, giving too much without learning from it, so just giving of yourself, doing things against the plan of your soul, not wanting to escape in your current direction, not summing up what you have learned, and not knowing how to communicate can be reasons for us being tired. So here are some emotional or emotional links to some of the symptoms of chronic fatigue. So sore muscles can be stored guilt. Headaches can be about not communicating with yourself. Tiredness can be basically too much flowing out and not enough coming in. Poor immune function can basically be any thoughts that are going against your own inner peace. Toxicity can be about giving your power away to negative thoughts. Depression is about hopelessness. Anger you feel you do not have the right to have. And then Candida is about frustration and anger. And again, not expressing those is important. So fatigue is very much, again, about resistance, boredom, lack of love for doing what you want to do, you know. Well, what is it you're passionate about? What is it that you're enthusiastic about? What's the thing that drives you and floats your boat and makes you feel alive? Are you following that? And here we've just got some verses. So, you know, are you sympathising versus empathising? Sympathising is like, you know, are you feeling what other people are feeling and taking it on? Or are you just understanding where other people are at? I don't know why that's done that. Sorry, I'm going to have to click through it all, because I don't know why I did that. Anyway. So we're saying sympathising versus empathising. Oh, I missed it. Yeah, I'm going to do the same thing again. We're nearly at the end of it.